What I'm sharing with you today is, some people like to drink tea, thinking that drinking tea can bring a sense of tranquility and ease in a busy environment. Some people like to drink coffee. A sip of coffee can refresh the mind and keep one alert. Both coffee and tea have their own benefits, and they are healthier compared to various carbonated drinks. So, which one is better? Tea or coffee? Recently, a group of renowned Japanese scientists formed a research team on elderly pneumonia, leading a study conducting a head-to-head comparison between coffee and green tea to see which one can more effectively reduce the probability of middle-aged and elderly people contracting pneumonia. This study, published on March 10, 2021, in the prestigious scientific journal Scientific Reports, analyzed the health of 573 elderly people aged 65 and above. It shows that drinking 2 cups of coffee a day can reduce the risk of elderly people contracting pneumonia by nearly half. In contrast, drinking 2 to 5 cups of green tea every day not only cannot prevent pneumonia, but can even increase the probability of pneumonia occurrence. Fortunately, this value is not significant, so green tea enthusiasts need not worry. A combination of coffee and tea is the better choice. Researchers at Tianjin Medical University collected data from nearly 500,000 people, analyzing the consumption of coffee and tea alone or in combination, and their association with overall mortality and cause-specific mortality. It was found that drinking less than 1 to 2 cups of coffee plus 2 to 4 cups of tea per day can reduce the participants' overall mortality risk by 22%, reduce cardiovascular disease mortality risk by 24%, and reduce respiratory system disease mortality risk by 31%. Both tea and coffee contain caffeine, and these 2 types of caffeinated beverages also come with another advantage in aiding weight loss. Research shows that higher caffeine concentrations in plasma lead to an increase in thermogenic response, resulting in higher energy expenditure and effectively reducing the fat content in the body and preventing the occurrence of type 2 diabetes. Specifically, with each increase of 1 standard deviation in caffeine levels in plasma, the risk of developing type 2 diabetes decreases by 19% to 23%. Moreover, the combined consumption of coffee and tea is more effective in reducing the risk of stroke and dementia than only drinking one of them. Although coffee plus tea is good, there are still several points to note. Although there are many benefits to drinking tea and coffee, many people drink them every day, but not everyone drinks them correctly. Drinking tea or coffee too hot. Drinking tea or coffee at too high a temperature may scald the esophageal mucosa, increasing the risk of esophageal and gastric cancer. The surface of the esophagus is covered with delicate mucosa, and food temperature has a significant impact on it. The most suitable temperatures are between 10 degrees Celsius and 40 degrees Celsius. Barely tolerable temperatures range from 50 degrees Celsius to 60 degrees Celsius, and temperatures above 65 degrees Celsius can cause burns. Drinking tea or coffee on an empty stomach is not advisable, especially green tea, which has high levels of tea polyphenol and caffeine. If consumed on an empty stomach, some active substances may bind with proteins in the stomach, causing irritation to the stomach and possibly leading to symptoms such as palpitations and dizziness. Drinking coffee on an empty stomach can stimulate the sympathetic nervous system, relieve fatigue, but it may decrease appetite, cause discomfort in the stomach, and even lead to gastritis, increasing the burden on the gastrointestinal tract and affecting gastric digestion and absorption. Long-term empty stomach consumption of coffee can also lead to nausea, bloating, and other conditions. When taking medication, it is not advisable to drink coffee and tea. Medications such as cold medicine, sleeping pills, vitamins, thyroid hormones, and other drugs are not recommended to be taken with beverages containing caffeine and tannic acid because the caffeine and tannic acid in them may interfere with drug metabolism and interact with each other, leading to adverse reactions. Long-term coffee consumption enhances brain metabolism and can reduce the risk of dementia in the elderly. This study was published in the prestigious Journal of Clinical Investigation, JCI, and led by Professor Powell. Comparing caffeine intake in mice, it was found that nearly 720 gene fragments were affected by caffeine components, and the impact of coffee on genes mainly manifested in the reduction of acetylcholine levels in the brain. While drinking coffee, the level of acetylcholine in the brain decreases, and the efficiency of brain metabolism increases accordingly. Professor Powell also stated that brain metabolism is closely related to the consumption rate of nerve cells. Long-term coffee consumption reduces the rate of loss of brain nerve cells in the elderly, which can have a very good preventive effect on dementia in the elderly, reducing the risk of dementia by about 41%. Moreover, brain metabolism and fat metabolism, insulin metabolism, and protein regulation are all related to the nervous system. Long-term coffee consumption may improve the immunity of middle-aged and elderly people and alleviate symptoms of hyperlipidemia and hyperglycemia. It can be seen that long-term coffee consumption has many scientific benefits for middle-aged and elderly people. Not only can it rejuvenate the brain and reduce the risk of dementia in old age, but it can also boost immunity and prevent some metabolic diseases. Middle-aged and elderly people with needs may consider developing a habit of drinking coffee. The effects may surprise you. How much coffee should one drink every day to benefit the health of middle-aged and elderly people? In Professor Powell's research, from the perspective of caffeine alone, it shows its effects on the brain and nerve cells, but there is no clear explanation on how much to drink. The American Cancer Research Center has conducted research on the relationship between coffee consumption and disease risk. After research, it was found that drinking 3 cups of coffee a day, 150 milliliters cup, the efficiency of caffeine's effects on the body peaks, with an average reduction of 10% in cardiovascular disease and brain disease risk. But if you drink more than 3 cups a day, the impact on health is not significant. So for middle-aged and elderly friends over 50 years old, drinking 3 cups of coffee a day, approximately 450 milliliters, is a reasonable reference. According to your preferences and physical condition, you can adjust accordingly. In conclusion, reasonable and long-term consumption of coffee is more conducive to health. But although coffee is good, it may not necessarily be suitable for everyone. These 3 types of people should not drink coffee. They are children, pregnant women, and people with neurasthenia. Children are naturally active and full of energy. Caffeine in coffee has a strong stimulating effect on the nervous system. Children drinking it may cause insomnia and restlessness, affecting life and learning. Research shows that caffeine has a significant stimulating effect on fetuses, which can accelerate calcium loss and affect childbirth. So pregnant women are not recommended to drink coffee. As for people with neurasthenia, they already experience insomnia. Rashly drinking coffee will further aggravate the condition of neurasthenia, which is not worth the risk. According to their actual situation, choosing whether to drink coffee and enjoying the health benefits of coffee rationally is a relatively correct choice. Speaking of this, many middle-aged and elderly people may want to try drinking coffee. And most of the coffee in supermarkets is instant coffee, which has become the choice of many middle-aged and elderly people. So, can drinking instant coffee benefit the brain and reduce the risk of dementia in old age? Can drinking instant coffee reduce the risk of dementia in middle-aged and elderly people? Professor Powell's research has mentioned that caffeine is the main driver of brain metabolism. Although instant coffee does not have a very good reputation, it also contains caffeine. Moderate consumption indeed can have a beneficial effect on the brain. A prospective study of 350,000 people on Phyllis Medicine showed that instant coffee reduced the risk of cardiovascular disease and dementia by about 16% and 19%, respectively, while ground coffee reached about 20% and 40%, respectively. Although instant coffee is beneficial to health, there are still some drawbacks. Moreover, most instant coffees add more sugar to improve the taste. Many middle-aged and elderly people have symptoms of diabetes and high blood pressure. Long-term consumption of instant coffee with a high sugar content is not a wise choice. Some cheap coffees even use trans fatty acids, which may increase the risk of cardiovascular disease. So for middle-aged and elderly people, moderate consumption of instant coffee can reduce the risk of dementia in old age. But it is advisable to choose high-quality products without sugar and trans fatty acids as much as possible. To what extent it benefits health, ground coffee is better than instant coffee. So please choose according to your own situation. In conclusion, coffee has many benefits for human health, especially for middle-aged and elderly people. It might be worth setting aside prejudices and actively trying it out. Perhaps there will be unexpected health benefits. Today's sharing ends here. You are never alone here.